Hello, welcome to Mental Health Hour. This is Dr. TAPO. I was just complaining to our great hosts at Love Bay how cold I'm feeling already, and it's only October. The weather has shifted quite a bit here in Ontario, and especially the region where I live. So I hope those of you in sunny climates, you're enjoying the sun, you're enjoying good weather. So I'm Dr. Tapo. Welcome to Mental Health Hour, where we talk about our mental health and we support each other, making good, solid decisions about our health, our mental health in particular. You can write or text. Our number is 437-778-3299, 437-778-3299, or you can email infolovebay@gmail.com, infolovebay@gmail.com. I'd love to hear from you. What's been going on for you, your loved ones? What are your questions? What are your thoughts? Let's support each other, making mental health our priority. So just a reminder that Mental Health Hour is for educational and informational purposes only. So I only provide education and information so that you can make informed decisions about your mental health, about even how you can support your loved ones who might need support with their mental health. So text 437-778-3299, and you can text while we're on the show. These days, we like to read your messages as they come in. So please feel free to let us know your thoughts or your questions. Email infolovebay@gmail.com. So the last few sessions, we started talking about suicidal ideation. Then we talked about stress, chronic stress, how that can lead to conditions like anxiety, depression, how that can impact even our physical health. So some of the highlights, chronic stress is when you've been stressed continuously for a specified period of time. It's starting to impact your sleep. It's starting to impact your appetite, your physical health. You might start getting heart palpitations. You might start sweating a lot more. You might have challenges breathing. You might even start having panic attacks, because the longer you stay in that condition of heightened stress, our bodies were not created to remain stressed. So if you keep your body continuously stressed, what might happen is you develop other conditions. Your body is always overcompensating. Stress basically makes your nervous system work over time, which can start to impact some of the organs in your body, how your body functions, even your digestive system can be impacted. So stress is not a good thing. And remember, I've said, don't protect stress, address stress head on, get rid of stress. Some of us like to procrastinate. We don't manage our time well. We don't manage our money well. We don't manage our relationships well. And all of these things just increase the stress levels in our lives. And there are some stressors that we really can't do anything about. If you're a parent with a sick child or with a child, period, we know that these days the economy is challenging. So we know that parents are stressed. You have a child, you have stress. We know that, which is all the more reason why you need to be aware of other stressors in your life, so that those that you can address and get rid of, you do that. But some of us, our families are stressful, our work is stressful, our private lives are stressful, money is stressing, everything is stress. And we're not doing anything about it. And that is dangerous. So we started talking about stress. We talked about stress over several sessions. We talked about anxiety. And now today we'll be talking about depression. And one of the things that I said was stress can actually lead to clinical depression. Stress can lead to generalized anxiety or other forms of anxiety. And these are clinical diagnosable conditions. So stress is not your friend, and you need to address it quickly. And I've said to those of you who are parents, let's not assume our kids don't have stress just because they're children. Check on your children's mental health as much as you check on your own, and then teach your children how to monitor their own stress levels, how to take care of their mental health, how to self-care. That way your family is healthy. We want healthy families in our communities. So before I start talking in depth about depression, I want to read some of the messages that have come in over the last few weeks. So the first message, oh, wow, all the way from Sydney, Australia. I think this is the furthest from Canada. Although I think we have received some messages from like Japan and parts of Asia, but Sydney, Australia, that is far. And this person writes from Sydney, Australia, saying, thanks for the program and topics. A friend of mine has stopped responding to my calls and has withdrawn from me. My friend lost her only brother earlier this year. So should I get worried? This is a friend who's worried about her friend. She's been trying to call her, reach out to her, but the friend is not responding. And this friend lost her brother earlier this year. And so she's asking, should she be worried? I think, yes, be worried if this is a change in your friend's behavior. If you always had that kind of connection, you were always connected, always in touch, you always picked up your calls, and right now this is out of character for your friend. One of the things that we've talked about when we talk about anxiety, depression, suicide, basically any kind of mental health issue or condition, one of the key indicators that something is wrong with a person's mental health is a change in behavior. So if they've always been someone, I'll give a very simple example. They're always on time for everything. You've known them for years and they're always on time. What happens if they're late once? You think, oh, okay, maybe something's happened. They're late twice. By the time we're saying 3 times, a pattern is established, right? So you need to be checking in on that person. Once might be an anomaly, maybe something happened, an emergency, whatever it is. So, okay, but still check on them. But when you see something repeatedly happening that you would say is out of character for that person, something is wrong. And it's time to ask some of those direct questions. What I said when we're talking about suicide and suicidal ideation, but this also applies to depression, anxiety, PTSD, any type of mental health issue. You don't beat around the bush. You don't ask like you're stepping on eggshells. You ask direct but compassionate questions. So you don't say, are you crazy? No. You ask, is something wrong? Tell them what you've noticed, why you're asking that question, and be very direct. You're somebody who's always been on time. You can always be counted on. But the last few months, I've noticed that you're always late. You don't pick up phone calls. I need to know if something is wrong because I'm worried. So be direct. We're not beating around the bush. We are maintaining respect and compassion, but we are being direct. So to our listener in Sydney, ask those direct questions. If they're not picking up your calls and you are able to actually go to their home or workplace respectfully, compassionately, do that and just say, like, I'm worried. I haven't heard from you. I've tried to call you several times. I know your brother passed away. and I just needed to make sure you are okay. Be that friend that goes that extra mile, especially when you've noticed these important, critical changes in a person's behavior. It can also be in their appearance, right? If you've noticed somebody who always had their hair was always neat, they always had their haircut, they always wore clean clothes, but you're now seeing them like their hair's jacked up, or it's out of character. Ask those questions. Be direct, but be respectful and compassionate, but ask the direct question: is everything okay? Because I've noticed, and list those things that you've noticed that are cause for concern. Check on your loved ones, check on your friends. If you're seeing a difference in their behavior, in their attire, in their conduct, okay? Next question. But before I move on, actually, to the person in Sydney, Australia, your friend might be grieving. And sometimes grief does require space. Maybe they're working through some things. Text them, send them an email, leave a voicemail saying you are available, you're there for them, and you understand if they might need some space, but you also hope that they're not isolating in a way that is unhealthy, but you're there for them. The door will always be open. Sometimes what happens is people need space, and we are persistent in contacting them. So we contact them 5, 6 times, they don't respond. And maybe you've left messages, but because they're not responding, maybe you're sounding a little annoyed or irritated or frustrated in your message or whatever it is. My point is, watch your tone, that it is kind, it is compassionate, it is respectful, but it's also communicating that the door will always be open. Maybe they're not yet in a place where they can reach out, where they can engage with you. So you want to leave that message like, listen, I know maybe you're grieving, maybe you need your space. I won't call again for a couple of weeks. Maybe I'll check in with you in a 2 weeks or in a month. In the meantime, if you do need me, I'm available. I'm your friend. I love you. Take care. Right. So you're letting them know that you will check in again in 2 weeks or in a month. So that communicates that you have not dismissed them, you've not given up on them, you've not shut the door. And it also lets them know that when they're ready, your door is always open, right? So be mindful and careful of your communication. Keep it kind, keep it respectful, keep it compassionate, and keep doors open. When they're ready and able, hopefully they will reach out to you. Check in with them maybe in 2 or 4 weeks, just to say, I know you're still, but I just wanted to check in on you. The thing is, especially with grief, what we often do as human beings, and we're all guilty of this, right? We hear the sad news, we're there immediately. We're at the funeral, we're at the burial, and then we disappear. And by the time we reappear again, we expect people to have moved on. But grief has no set calendar. And we've talked about grief in the past when somebody is grieving a loss, especially of a brother. I mean, I can imagine if it was a sibling of mine that I grew up with, playing with, like I will be at the funeral, we will bury that person together and all that. But for a lot of people, recently I was talking to a young man who has lost both his brothers. There was 3 of them in the family, and now he's left alone. And he talked about when everybody had left after the burial, the funeral, everything, and everyone is now gone. for him, that's when it hit. That first shock actually hit after the burial and all of that. People grieve differently, people respond to loss differently. But what we want to be is there for them, whatever way they grieve and respond to loss. Where we start getting concerned is if many months later, they're not going to work or school or whatever their occupation is, they still are crying uncontrollably. Crying still happens. It can still happen even 30 years after a person is gone. That's okay. But when we start to talk about needing clinical support with grief, is when this grief is now, I will say, disrupting or preventing normal everyday activities. So they can't work anymore, they can't go to school anymore, they've completely isolated, are losing relationships, not connecting with people. Then we become worried. And then we suggest maybe seeing a therapist, getting some kind of professional support. Okay, so also many miles away from Canada, in Accra, Ghana, we have a writer saying, "Dear Dr. Tapo, I've been going through a depression which I never experienced, and I've been experiencing some bad thoughts. What can I do?" Okay, so I will come back to that. I will just go just next door in Hamilton, Ontario. Somebody said, "Dr. Tapo, I've recommended this program to my friends and coworkers. Very informative, from Hamilton, Ontario. Thank you so much. Definitely spread and share the wealth. Invite your family, your friends, especially those that you might be concerned about. Let them know that there is this show. They can send in their questions, they can send in their comments, and we will respond. 437-778-3299, 437-778-3299, or email infolovebay@gmail.com. Recommend this show. Tell them to get in touch to ask their questions. Sometimes we know there's a stigma in seeking help. Sometimes people can't afford to seek help. Sometimes people don't have the right information. Whatever it is, our role here on the Mental Health Hour is to provide information so you can make the right decisions about your mental health. We do not replace qualified, licensed, registered therapists, doctors, physicians. That's not what we're doing. We're providing information and education. Okay? So, thank you to the listener in Hamilton for recommending this program to your friends and coworkers. I encourage everybody else to do that so we can all learn and grow together. Okay, so Dr. Tapo, I've been going through a depression which I've never experienced. I've been experiencing some bad thoughts. What can I do? So this is our listener in Accra, Ghana. So I'm going to talk at length today about depression, and hopefully that will answer some of your questions to our listener in Ghana. So when people talk about bad thoughts, so that's a very, very general and broad term. So I'm not sure exactly what kinds of thoughts you are talking about. I'm going to assume if you're saying bad thoughts, because we've been talking about suicide and all of that, that maybe you're talking about suicidal ideation, which is when you start thinking about ending your life. Bad thoughts can also refer to negative thoughts, which is when you mentally you're ruminating. So it might be even bad thoughts about other people, about your relationships, about yourself. Sometimes we talk about low self-esteem, but when we're depressed, it's not just about low self-esteem. You can have somebody who had the healthiest self-esteem you could think of. They had confidence, they trusted themselves, self-worth, they had all of that. And then they go through a period of depression in which all of that seems to have been eroded. They start losing confidence even in their skills and abilities. They start looking down on themselves, devaluing themselves. And these are some of the signs and symptoms of depression. So when you talk about bad thoughts, I'm not sure exactly what you're referring to, but we are going to talk about depression at length, and hopefully we'll start this week and we'll continue in following weeks, and hopefully that will answer some of your questions around depression. So depression is one of those we talk about one of those things we talk about all the time. People have popularized depression. I like to point out what pop psychology has done to our society, where people throw around these terms like they're nothing, like confetti at a wedding or rice at a wedding, and we're not really thinking about what we're saying. So I like for us to clearly understand and define certain terms, so we stop using them loosely, which takes away from the actual and real struggle of some of these things. I mean, if you're in a class of 30 people and 24 of them keep talking about, I'm depressed, I'm depressed, I'm depressed, you start to think it's nothing because everybody's claiming it. You start to think it's nothing. And yet, depression is one of the most challenging things human beings experience in their lives. There is no cure for depression, but there are ways to manage it, to treat it. And we can talk about medications, we can talk about therapy, we can talk about lifestyle changes. But sometimes when somebody is depressed and they tell you they've gone to the doctor or they're going for therapy, people immediately think that then we should see a difference, then this thing should stop. Or maybe you yourself have started taking medication or you've gone for therapy and you're wondering, but I've been doing therapy, I've been doing the work, I've been taking the medication. Why am I not well? It takes time. And don't do these things with the view of, I'm going to be cured. Because it's not about curing, it's about treating, it's about managing, it's about coping. And then maybe one day you wake up and things are a whole lot better. And there's some people in life who go through depressive episodes. And here I'm not talking about bipolar, which is a condition that does have cycles of manic or psychotic depression. That's not what I'm talking about. I'm talking about there's some people that in their lives experience highs and lows. Sometimes it is, I'll say, precipitated or started by an event like the loss of a loved one. So it could be grief, it could be loss, and you go through a period of depression. So those are like some of those situational or circumstantial types of periods of depression. I'm feeling depressed because I'm going through divorce, or I'm feeling depressed because I've lost a child, or I'm feeling depressed because my parent has passed. You know that is the reason why you're feeling depressed. And then there's some people, they actually don't know why. Like, why am I depressed? I have the job, I have the career, I have the family, I have the children, I have everything that I thought I ever wanted, but I am depressed. So don't feel bad. A lot of people with depression also then carry guilt and shame, which makes it all worse, right? So you don't want to be feeling guilty, feeling shame, and carrying that on top of the depression, because you keep telling yourself I should be better, or people around you keep telling you you're selfish, you're this, you're that, you have everything you want, you should be happy, you're ungrateful, you're this. Those types of things don't help you get to a place where you feel better, right? So do away with the guilt, do away with the shame, focus on coping. First of all, how do I cope while I am in this? Then there's other types of depression, like seasonal affective depression, SAD. Uh, it comes through, it's a disorder, seasonal affective disorder. It comes because of the winter. So a lot of climates where the winters are really harsh and dark, people feel great through the spring, through the summer, then the weather starts to change and they start to feel low, they start to feel depressed. So that is a seasonal type of depression, and it's called seasonal affective disorder. Okay, so there are different types of depression, and I'm going to talk about as many of them as I can over the next few weeks. And like I said, stress can lead to depression. If you maintain high levels of stress over a long period of time, you increase the risk of developing depression, anxiety, panic disorders, and other physical conditions. Okay. There's also depression that is associated with substance use, marijuana, alcohol. These are things that people actually think, oh, I'll just smoke a joint and I'll feel better, or I'll have a few drinks and I'll feel better. Alcohol, marijuana, all those things actually, if you're depressed, do not go there, because it doesn't help the depression, it actually makes it worse. Okay, so we'll talk about substance use and depression as well as the weeks pass. So do send us your questions as we're talking about this. 437-778-3299. If you've been diagnosed with depression, share your experience. What was it like? What did your doctor tell you or your psychiatrist tell you? Did they put you on any medication? Did the medication help? What was it like for you? Okay. So depression, let's start by just defining it so we all know what we're talking about. We're on the same page. Okay. So depression is a clinical slash medical illness. Often when clients come to me and I ask them that question, so what brought you here? And they say depression, or I am depressed. I will ask, has that been diagnosed? So people will say, I am depressed. You know yourself if you're not happy and cheerful and all of that. But what we are talking about here is the diagnosable clinical medical condition of depression. You go to your physician, they diagnose you, they do whatever tests and assessments, and they diagnose you and say, yes, you have depression. All right. And then they might offer you medication, they might recommend you go to a therapist. What research shows is the best treatment for depression is a combination of medication and therapy. Not that these things don't work on their own, but the people that have had the most success and been able to get back to their everyday normal lives are people that have used both the medication and depression and therapy. So with medications, it doesn't mean because you started on them, you have to take them for life. I have known some people that have been on depression medication for like 15 years. It's really not supposed to be that way. Those people, it's often because they stopped going to their physician, or they like being on medication. And the thing is, our bodies adjust to medication, right? So if you imagine somebody who's been taking medication for 15 years, they're probably on a very, very high dose for it to do anything. I've had clients talk about not wanting the medication anymore because they felt it made them sluggish, it interfered with their libido, they gained weight, different side effects. So, if you have been prescribed medication, what best practice, let me put it that way, recommends is from the day you're diagnosed and the doctor gives you medication, 2 weeks later, check in with your doctor. So, on your way out, before you even go fill that prescription, on your way out, book a follow up in 2 weeks. Why? Because if anything is happening with that medication, you need to let the doctor know. And it normally takes about 2 weeks for your body to start adjusting and reacting the way it should to the medication. So you might start medication today, and because you just started it, your body is not used to it. It knocks you out. And I remember one client had just started antidepressants, which is what medication for depression is called. And he took it the first day, and it made him sleep for 16 hours straight. And so he came back and he was like, no, 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 I can't do this. Like, I can't live my like 16 hours. Like, then I have no life. What about work? What about this? He had taken some time off work, fortunately. So your body, you don't know how your body might react. So that first time, the first few days, it made him extremely drowsy. He slept so much. But as his body adjusted to it, his sleep patterns readjusted. So in the end, he wasn't sleeping so much. And within 2 weeks, his body was kind of okay. Within 6 weeks, the medication had started to do its work. So my point is the medication that doesn't start working on the depression itself right away. You don't pop a pill the first time and immediately your depression is gone. That won't happen. Even in 2 weeks, it won't be gone. Even in 6 weeks, it might not be gone, but it has started to work. And what we mean by that is you start to see maybe you don't feel as low as you used to. Maybe now you're sleeping better. And when you wake up in the morning, you're able to get up and go about your day. It starts to work in different ways, but it doesn't happen immediately. And then some people then stop taking the medication because, oh, it worked, so I'm now fine. And they stop. And within weeks, things have fallen apart again. So, best treatment for depression, research shows, is a combo of medication and therapy. The medication works in your body at a chemical level, it doesn't change your behaviors, it doesn't change your attitude. That's what therapy is for, right? So, therapy will teach you how to address some of those bad thoughts, negative thoughts. It will teach you how to maintain relationships through the depression. Therapy teaches you better ways to cope. Medication doesn't do all that. Medication works at a chemical, physiological, biological level. Therapy works on a behavioral and cognitive level. Okay, so you want a combo of both. You can go for therapy and do the cognitive behavioral therapy, which is the most common therapy used for depression, and it will look at your cognitive, always refers to the way your mind works and processes things, behavior, how you behave, respond, react. We've talked in past sessions about like emotional regulation. We've talked about even things like boundaries and all of that, which you might think like, but I'm depressed. What do boundaries have to do with it? We'll get there. We will get there. But therapy is for how you're thinking about things, processing things, and how you're responding, acting, and reacting. Whereas the medication takes care of things physiologically. So that combo is like the best way if you've been diagnosed with depression, anxiety, many of these mental health disorders. Yes, take the medication, but also do the therapy. Having said that, you can also do one without the other, but the best results have been a combination of both. So I know I started to say, let's define depression, and then I got sidetracked. So let's define depression. So depression may be caused by one factor alone. So like I said, maybe it's grief, maybe it's the season, maybe it's poverty. I'm sorry to say, a lot of people do get depressed because they're poor, they're struggling, they're losing hope in life. Poverty can lead to depression. So it can be caused by one factor alone or a combination of factors, including biological, psychological, environmental. So trauma, you might experience sexual assault, for example, or you might be physically assaulted, you might be robbed, whatever. Trauma, which is a psychological response to some external stimuli, can lead to depression. It can be environmental. When we talk about environmental, it's where you live or where you work or the things outside the external stimuli, right? If you're living like there's a documentary I watched recently. I think it's called There's Something in the Water, and it's about environmental justice in Nova Scotia, Canada. And it's basically looking at how generations of families have been impacted in certain neighborhoods because of dumping chemicals and garbage in their neighborhoods, high rates of cancer, stuff like that. Imagine growing up or living in a place like that. You are likely to get depressed. So, environmental can be where you live and how you live, or it can be at work. You have those a mean boss, colleagues that gossip behind your back. It could be at school with bullies. So, environmental is those outside things, outside of your home, outside of you, outside of your family, that can impact you and cause that depression. Okay, so depression is a medical illness. It's diagnosable, it is treatable, not necessarily curable. The way we define cured is somebody pops a pill or somebody goes for therapy and they're cured and it's all gone and they're okay and it doesn't impact them. Depression is not curable in that sense, but it can be treated and you can get better and you can regain your life, your relationships, a better quality of life. All of this boils down to your quality of life, right? Because you want to live a life that is healthy in relationships, healthy in your family, in your home, in your body, so it's about your quality of life. And when you have depression, that's one of the things that are impacted the most, the quality of your life. You're not enjoying life. And by enjoying life, I'm not talking about chase rainbows and skipping meadows. That is unrealistic. What I'm talking about is you have some satisfaction and contentment with the life that you're living. And some people do get depressed because they don't have that. Okay. So it's a medical illness that affects the brain, which in turn affects the rest of the body. So depression is psychological, it is mental, but you feel it and it impacts your body. The same way we talked about how stress can impact your body, how anxiety can impact your body, depression can do that too. Okay? So depression can impact or affect anyone. We have young children, very young children. I think the youngest that I have come across who was clinically depressed was about 6 years old. Now, when it comes to children, the medical field, I'll say, are really wary or reluctant to diagnose small children, especially with mental health disorders. There are some like ADHD and some of those behavioral ones. They might diagnose that at a relatively young age, but there are some that the medical community just doesn't want to diagnose yet because the person is too young. And you don't want to put a 6-year-old on antidepressants. But that doesn't mean they're not depressed. This is where we would usually say, try the therapy first. So you've been concerned about your child. Maybe they used to like playing outside and playing with their toys, drawing art. They used to dance and sing. They were quite lively and all of that. And now that has changed. And you've noticed certain things, they're not happy anymore. They cry easily. They're irritable. They're not sleeping well. A lot of indicators, and you're thinking something's wrong with my child. It could be depression. It could be something's happened at home. A lot of small children, especially those that have experienced child sexual abuse, do get depressed because even when they're really small, it is such an unnatural thing that they know this is wrong, but they can't articulate it. Maybe they can't explain it, but something inside of them instinctively, they know this is wrong. And those children end up depressed. And because we're not thinking that way, and we don't want to think of our kids as being depressed and all of that, we don't immediately seek the help that they need. I've known parents who would dismiss things because, oh, she's only 6 years old. That doesn't make sense. But the child was depressed. And when they finally did get the help that they needed, it turned out there was some sexual abuse that had happened. And this child was depressed. So even small children do get depressed. Small children have stress. Small children have anxiety. As long as they have a brain and a psychology and they're a living, breathing human being, they can feel and live the way you do as well as an adult. So let's not be quick to dismiss the mental health needs of our children. We have high expectations of children that are really quite unreasonable. Our expectation is children should always be laughing, happy, smiling, causing chaos because they're happy, they're children, but as soon as a child is not that, we dismiss it, we ignore it, we are in denial, and we put that demand on them to be happy because those are our expectations of what a child should be. If your child has changed and you've noticed it, ask them what's wrong and let them know that whatever it is, you're there for them, you're going to help them, you're going to support them, you're not going to judge them, you love them. And do those things. Love them, support them, don't judge them, be there for them, help them get the help that they need. So children do get depressed as well. The medical community doesn't like to put children on antidepressants. They will rarely diagnose a child straight up with depression, especially small children. But I have known a number of children that had to go to a child psychiatrist and were diagnosed with depression at young ages, less than 10 years old, because it happens. Children, adolescents, so teenagers, young adults, middle-aged, older people, anyone can get depressed and be diagnosed with it. Remember, we said it can be circumstantial, it can be biological, it can be psychological, it can be environmental, it can be seasonal, it can be many things, and we'll talk about it some more. So about 20% of adults, 20% of adults, think about that, in the world, 20% of adults in the world will have suffered from depression at some point in their lifetimes. So it is, in that sense, quite common. And some of us kind of soldier through it and get to the other end. My advice is don't do that. Do not do that. Don't dismiss it. Don't say it will go away. Don't feel ashamed or guilty and all those things. Just get help. Get help, because 20% of adults, think about it. That's a huge, we're talking millions and millions of people have experienced depression. And research shows those that seek help and seek it early are less likely to go through deep periods of depression again. But those that soldier through it, it lasts longer and it's recurring. It keeps coming back. And each time it comes back, it's a lot worse because you're not getting help. So get the help that you need. 20% of adults in our world have at some point in their life have had a depressive episode, have experienced a depressive episode. 20%. So what we're talking about here is not simply feeling low or feeling down. We all have those days when we're just not in the mood and we want to be out by ourselves, and this is not what we're talking about. When we're talking about depression, we're talking about something that is severe and goes on day after day after day after day. It's not simply a mood switch or a mood swing. Like yesterday I was happy, everything was fine, and today I'm depressed. That's not what we're talking about. We're talking about for 2 weeks, for 2 months, for 2 years, you've just been low. Low enjoyment of life or zero enjoyment of life. You found you're isolating a lot more, you're withdrawn a lot more. Like we talked about, maybe your sleep is impacted, your appetite and diet are impacted. You've also stopped taking care, like even your hygiene. your clothes, your appearance, like you don't even care about those things anymore, but you used to. I know there's some people that have never cared in their life. If that's you, more power to you. But if you're somebody that used to, and for the last 3 months you really just cannot be bothered, you're going from one job to the next because you can't maintain employment. Maybe you've dropped out of school. Maybe you're eating a lot more than you used to, and you're not exercising, and you've gained weight. All of these things combined, right? So when you go to a physician or a psychiatrist or even a therapist, they're often looking for a number of signs and symptoms to get to the point where they say, okay, yeah, this is depression. You might be somebody who has suddenly gained weight, but that doesn't necessarily mean you are depressed. So it's a combination of a number of signs and symptoms that they will look for. So, emotional symptoms like you're feeling sad, empty, hopeless, numb over an extended period of time. You're feeling restless, irritable, anxious over a period of time. You're having a hard time concentrating, remembering things, making decisions over a period of time. You're less interested in the things that you used to enjoy and participate in. So maybe you used to go to the gym, maybe you used to like hanging out with your friends at the pub or at the library or wherever you and your friends like to hang out, and you're not doing that anymore over a period of time. Feelings of guilt, shame, worthlessness over a period of time, and repeated thoughts of death, of suicide, of harming yourself or somebody else. So, depression can make you suicidal or homicidal. A lot of people have actually killed and hurt other people because of depression. So it's a combination of these emotional symptoms over a specific period of time. So you don't feel low for 3 days and immediately say, I'm depressed. Maybe you're feeling depressed, but you don't have the medical illness of depression. But if 2 weeks go past and you are having a hard time getting out of this funk, go to the doctor. It's the same thing I said about anxiety. If you find yourself for the last 2 weeks, I feel anxious all the time, go to the doctor. Stress for the last 2 weeks, like I've just been heightened stress, go to the doctor. So any type of emotional state over 2 weeks that is preventing you from living your normal everyday life, go to the doctor. It might be physical. So you might think, oh, but I'm just feeling low. Why should I go to my practitioner, general practitioner, or general physician? Because it might be a biological thing. I've known clients who had depression because of some kind of physical deficit in their body. Sometimes it's thyroid, sometimes it's iron, other things in their body that are not functioning well, that are not at the right level, and that can cause depression. Remember what I said, the nervous system, it's connected to every part of your body, every part of your body. So even something as disconnected in your mind, you're thinking, yeah, but what does my iron levels have to do with depression? It actually can lead to that because your body is not functioning at its optimal. So that's why you should go to the physician. If you're feeling any kind of way over 2 weeks and you're having a hard time breaking out of it, and it's getting more and more challenging, Don't wait too long. Go and see your physician. They will do those panels, blood tests, physical, everything. And remember, and I keep saying this, try and have a physical at least once a year. Just go to your doctor and say, Doc, check me out. Send me to the lab, do the blood test. I just want to know that I'm healthy. This practice is good because if anything, even if it's cancer, whatever, they will catch it in time. Some people have not seen a doctor for 10, 15 years, and then all of a sudden, everything is like crisis level, and you go to the doctor and they tell you it's stage 4. And especially the older you get, go to the doctor at least once a year, have all the blood tests, everything. The doctor knows how to do a general physical exam to make sure everything in your body is functioning as it should and you're healthy physically. So, physical symptoms: low energy, feeling tired over 2 weeks, changes in appetite or weight. Again, you've noticed over the last 2 weeks, maybe you're eating way more or you're eating way less. Changes in your sleep patterns over the last 2 weeks, increased use of drugs or alcohol over the last 2 weeks, self destructive behavior, like you just don't care anymore, you cannot be bothered, and you're not taking care of yourself. You're not showering, you're not combing your hair, you're not brushing your teeth, those types of things. Self destructive behavior, loss of control, also uncontrolled rage that you feel physically in your body. Some people are short tempered because they have depression, not because they are nasty, horrible people. So, over 2 weeks, you see these things, go to your physician. That's the first port of call, is your physician. I've been feeling this way physically, I've been feeling this way emotionally. Please just help me out. I need to know everything is okay. So, headaches, chronic headaches, backaches, chronic stomach aches, chronic diarrhea, chronic nausea, pains and aches in your body, digestive problems, dizziness, lightheadedness. Do you see that a lot of these symptoms, if you listened to the mental health hour episodes on stress, a lot of these are the same symptoms as clinical depression, as PTSD, as anxiety, even some of them as psychosis, bipolar. A lot of mental health conditions have more or less the same symptoms. That's why you do not dismiss anything. Definitely do not self diagnose. Go and see a professional who knows how to properly assess and diagnose you. It could be depression, it could be stress, it could be PTSD, it could be anxiety, it could be a host of different things. The symptoms are a lot similar, very similar. So you want to get checked out. So we don't have it, like I said earlier, depression could be following a significant event like a loss or sexual assault or something like that, that you can really say, after that thing happened, I became depressed and I couldn't shake it off. I went to the doctor, they diagnosed me with depression. But it could also be a combination of different things, including the biology of your body, right? If your body is not working like it should. So we're not clear or 100% certain to say this is the number one reason why people are depressed. 20% of adults worldwide have had depression. I guarantee you we probably have 20 different reasons, right? So, one of the predominant theories is that depression can be caused by an imbalance of hormones and substances in our bodies, an imbalance of naturally occurring substances, neurotransmitters in the brain and spinal cord. So, your nervous system, it always comes back to your central nervous system, that brain spinal cord, that part of your body that controls so many things and yet relies on so many things to function the way it should. That's why the first thing you need to do, if you've been feeling some kind of way for 2 weeks or more, go see your doctor. Okay, so I'm conscious of the time. I will leave it there. We'll continue talking about depression next time. Send your questions, send your comments. Let us know what you're thinking. Let us know what you've experienced. Have you been diagnosed with depression? What have you been doing in terms of treatment? Have you gone for therapy? I would love to hear from people who've gone for therapy. What was your therapy experience like? So get in touch. Text 437 778 3299, 437 778 3299, or email infolovebay@gmail.com. I'm wishing you a wonderful rest of the week, a wonderful rest of October, a wonderful rest of 2024. Keep warm if you're like me and temperatures have just dropped. Stay sunny if you're in those wonderful climates. If there's anyone out there that can afford to buy me a ticket to Jamaica, I am ready to go. Have a wonderful week. Be kind and compassionate. Good night.